Hi, good evening, Vikash. I'm good just to catch up with you and to talk to you regarding the evolution of healthcare and the wellness across the globe. I know you spent long years in England, and after spending long years in England, you have seen how the healthcare and the wellness program across different segments has evolved. And then you chose to come back to India for several reasons. And I know your vision. You wanted to really create a positive impact in the humanity, right? So that people should live their healthy life. People should, maintain their good health in terms of preventive and, taking care of their health, right? So how do you see, due to COVID, the across the globe, and you know me, I have, lived in the U.S. for last several years and in the technology arena, right? So I have seen that the health part has been really shaken due to COVID. It has given us the wake-up call to see how we should lead our living, how we should really see that, our health being well-being should be taken care. So how do you see this, as a change agent for our human beings? And as a practicing doctor, what are your thoughts and vision going forward?
Nice to hear you, Alak. It's really great talking to you on the platform to talk about how healthcare industry is revolving and what are the changes we see over the past 6 months' time, pre-COVID and post-COVID. How do we see that industry? Um, what do we see as a kind of awareness going across the societies, going across the employers, going across the government, to think around the healthcare industry. So I'll just take you a back step, to just give you a kind of, my experience and the way I look at the way the vision has been derived for Beta Cura, the company I run. So back in England, when I was spending my time, understanding the governing policies, regulation of the country to treat the patient, um, and when I compare that regulation and the regulations and the governing bodies in India, there's a lot more difference, right? I wouldn't blame anyone on this because of course the kind of population we do have in India, it cannot be expected to have a personalized care through the humane driven approach. So definitely we would have to have the technology built in to bridge that gap. But at the same time,
Hmm.
what I see is like when I was a kid in India, right? I'm talking about 20 years ago. I always used to see that, I had a family doctor walking in, and
Hmm.
whenever somebody gets sick, like my granddad gets sick, he always had that, confidence that no, I want to go ahead with this doctor. I blindly trust that doctor no matter what. He's the god for me. So that connectivity has lost actually somewhere, that trust has
Hmm.
gone lost. If I talk about England, they have a very tiny population to handle. If you talk about NHS, the load, like what England deal. They have a personalized care. As soon as you step into the country, you do have NH card, right? National Health Card, which takes care
Hmm.
of your A, B, C, everything. You are really assured. You're shielded with the kind of protection what you get from the government. Because when you talk about the ratio, like available GPs against the number of patient the country does have, it's quite manageable. But that's not the case in India, and that's where when the COVID started back in March, right? It was really a wake up call for all the authorities to understand where we are. It was a kind of wave which was really really difficult for Indian government to handle because the kind of population we have, the kind of limited insurance penetration we have in the country, right? The people are having out of pocket expenses, right? There's no personalized care. There is a huge
Hmm.
gap between the corporate health and the basic health care. There's a huge gap.
Hmm.
That's where Beta Cura came in picture. We thought um, it's not about just seeing the opportunity. It's about just seeing those challenges and creating something which can help the human society, humanity, and you keep progressing from there. So Beta Cura started back in early this year. It's a very early time for us, but we have managed to serve more than 20,000 COVID patients for their
Mm-hmm.
testing, for their home isolation programs. Uh, and that was kind of journey we had over the past 6 months time, expanding ourselves from Bangalore to 6 other cities. So we have been operating on the COVID segment in 7 cities in India. It's been quite a good journey. Now what is next? How are we adding value to the people's life, right? So I was seeing like the people are being found positive, right? So they, if they have gone through the testing, they are found positive, but they don't know what is next. That's where the
Mm-hmm.
personalized care comes in picture, where the Beta Cura ensure that, hey, even if you're found positive, so when I send my technical officer to anyone's home, I assure that my technical officer talks to the patient saying that, sir, don't worry about it. We are here to support you no
Mm-hmm.
matter what is going to happen. Tomorrow your test
Mm-hmm.
may come positive, may come negative. You are under the assured hand. So we have a team of
Mm-hmm.
doctors, we have a team of nurses who runs this home isolation program under COVID. Uh, but again, like Alak, when I started talking to you, I realized, because from coming from the medical background, I don't have much sense of how the data can be utilized to
Mm-hmm.
leverage this gap, what we see in the industry. I may be
Mm-hmm.
serving now whatever the X number of patients or the or corporates, but at the same time, if I have a help of technology, because we all understand as an industry leader that
Mm-hmm.
next generation is going to be the data science generation. If you do have data, that's where you
Mm-hmm.
have to enable yourself and keep moving from there. I see a lot of companies, a lot of startups coming in the industry, but they fail to structure their data at the right place at the right time. They realize this later on when the time has gone away. It's hard for them to come back, restructure the data. They lost that opportunity. Like it
Right.
can it
Right.
can add value towards the cost saving. It can add value towards the
Mm.
accuracy. It can add value towards your decision making. So that's where we.
So perfect segue, as Vikas you have been mentioning, and as you just talked about the bridging the gap between the awareness, the health awareness, and also about the wellness, right, in the corporate world. So we have seen, we have witnessed across the globe, in the US as well. And as you know, you also touched upon the technology coming in, the data richness coming in. And as you know, we have partnered and I'm leading Centriqe, which is AI, machine learning, process automation based company, providing the richness of data to offer personalized care, right, or personalized services. How do you see that personalization can be effected among the corporate segment? Because at the end of the day, people are very important among your patient care, and personalization begins with communication, engagement, interaction, right? And at the same time, knowing the individual in and out. So how can we enable with the technology to know the person with the complete, in terms of the health diagnostics, in terms of the stats of the health, right? So that is where the data comes in to help doctors, practitioners, and help them to prevent as well as to provide the personalized care. So can you probably share that the services which you are bringing on board? So let's say COVID is one element where people are getting aware with some kind of vaccination, preventive care, preventive measures, even though they are infected with COVID, what they should be doing, how they should be doing. And people are getting sophisticated. They do have the smart devices in their hand, right? So how, as a doctor, you are building a better cura to enable corporates, large organizations like Oracle, IBM, Accenture, Deloitte, and people working out there, how they should be seeing your services along with Centriqe enabled AI based services, where we are helping them to offer personalized care, right? So that we should be giving them proper guidance that you may be looking for this kind of a service or care. Can you touch upon those services which you're
Really?
going to bring about?
Certainly, it's a very good topic, and I see, as I said, like in Beta Cura, it's a kind of 360-degree care what we are trying to create in terms of healthcare. So when I go to organization like IBM or Deloitte or TCS, we want them to feel secured and ensuring that their employees are getting one-stop solution.
Hmm.
The pandemic, since the pandemic has started, we are seeing like hardly 10 to 15% of the employees are walking into the office just to stop the spread, or probably the kind of precautions we are trying to recommend to all the corporates. But at the same time, uh, if you look at the kind of industry we are in right now, there were so many companies who has or healthcare organization who has gone very far in terms of OHC, occupational health centers. But when I study that occupational health center, I see lot many gaps. Even though you're just managing their, the physical activities or their mental activities or their stress level or their posture level or their body metabolism, um, are those data really gonna make some sense for you, or are you just giving those data to HR to record it? Are you really trying to get something out of it, find some clinical observation out of it, uh, alert, raise those kind of alarm which is needed for your employees to know, as well as are you trying to find out any solution around it? So Beta Cura, as I said, we are trying to find out those checkpoints which can basically be personalized with the help of technology. Also ensure that no matter where you are, as I said, Beta Cura is the last mile care. You are in office, you are at home, wherever you are at your vacation, we don't mind, but we will ensure that you are protected through Beta Cura at a one
Hmm.
step
Hmm.
one stop solutions with the enablement of the technology which I'm expecting from you.
Exactly. And this is very, very fascinating time where we will enable your last mile healthcare. As you mentioned, everybody is looking for the last mile care, right? Wherever they are. And technology is in our hand. You have seen that smart devices we are carrying all the time anywhere we go. And that is where Centric comes in. Centric is enabling with the Ask Buddy, which is a chatbot, which enables people on the smart device to interact, to communicate with Beta Care services, right? And when you have a voice communication enabled on your Ask Buddy, the voice would be answered through your last mile care, which you're talking about. And at the same time, that can be communicative, that could also transmit to the healthcare service providers. At the same token, now we are capturing the data based on interaction. So, based on what you are looking for from the corporate executives, those first-hand information should be captured and then processed, and then your healthcare doctors, they should be able to communicate preventively or given the preventive guidance or looking at the preventive measures. And then once you're looking at any diagnostic test results, that could be also published on their smart devices. So you see where the technology impact is coming in. It's very powerful. And the journey which we're going in with you as Centric and Betacura, I think we should be able to address the gap which you defined, the gap which is basically prevailing at this moment, where people are dependent on the healthcare service provider, the hospitals, clinics, or whatsoever the labs of the world, where we should be able to facilitate that through
Yeah.
the technology. So at the end of this, where do you see people should be embracing this technology? Because you are a practitioner, you are as a doctor, can you provide some guidance where the young generation, they are understanding the technology on their smart devices, but that they are little bit reluctant in sharing the data due to health privacy? How do you ensure that the health data is private It is not going to be shared. It could be protected, but the moment they share, doctors should be able to provide the better healthcare services. Can you provide some guidance on that?
Well, yes, it's one of the concern what I see in the industry in terms of data security. Uh, if I talk about myself, right, if I see some kind of app which has been introduced, application which has been introduced, the first question which strikes to me is my data really going to be secured enough to,
Mhm.
give my personal information? Because when you, I don't want to name the companies, but when you try to browse anything that gets captured at some point, right, at the back end, I'm not sure how does that work. So coming
Mhm.
to the healthcare, right, there are many numerous companies who are trying to build many EMR solution where all the data can be recorded, secured, HIPAA compliant. They all talk on those terms, but in practice, I see still there are a lot of room for the improvement. Now, coming to the mindset and awareness, India is the largest company using the smartphone right now in the world, next to US, I believe. Um, and this is the biggest opportunity for any healthcare, tech enabler to capitalize this opportunity and connect to the people. Now, how the data is going to be secured, that's something. Uh, it's a kind of technical answer which has to come from the technological driven company. Mhm.
And that is where we come in. And as you mentioned, that people should be aware that all their data is secured by the technology company like Centriqe. Since we are data rich company, we are data, storage, data processing, and giving them data driven insights. The all data which is shared to the healthcare service provider, we capture the data, we process the data, analyze through personal secured information system. That means we are complying to HIPAA Act, and we are also complying to health privacy. So the awareness what we are trying to give to our millennial or to our people in the new generation, that what you are sharing is secured. But as you share, more you share about your health, more healthy you will be, more aware you will be through Beta Cura services, because you are giving them preventive guidance. You are also personalizing the services. You are caring about their disease or their ailments or their indications, and you are giving them alert and notification, right? So any symptomatic, let's say, events are occurring, you are able to capture in beforehand, because that is where it is about data driven intelligence. So give an example. If let's say blood pressure level goes up, right, who should know? First of all, the individual should know, and once individual should know, the doctor should know. If
Yeah,
doctor knows about blood pressure going up, there should be some suggestion or indication should be given by the healthcare service provider. As you said, the last mile service. So you would be able to guide in real time beforehand, before damages occurs, right? So that is where Centric is enabling your Beta Cura services. While you are providing a lot of health checks, health monitoring, preventive care services to different ecosystem, different corporates, people who are looking at age care services. You talked about that, which motivated me, Vikas, right? Age care
absolutely.
services, and let's say, in terms of dialysis care centers, right? All those areas we should be working together. And from the technology standpoint, I can assure you that whatever you are looking for on the technology, we will be able to provide in real time. Process automation. We can automate processes. How do you capture the data? We will enable that. How do we get information about the patient in real time on a smart device? We will enable you that. How patient interacts with your services on a smart device, that is, we will do with the chatbot, right? So that is the magic of the technology which you should be leveraging to empower your patients. And that is what we are announcing with you, Vikas. Centric is announcing healthcare services vertical to go after with you, and we should be able to penetrate in all the wellness program which you are introducing.
Fantastic. I'd be really excited because having somebody like Centriqe around is a kind of enabler towards our vision because I may think of like many clinical correlation setting up the last mile care, but in order for me to be intelligent, on my decision making, that's where I see Centric can play a critical role.
And artificial intelligence is nothing but giving you data-driven insights.
Right, right.
We will make you more intelligent about your patients. So as you are catering to large number of patients, right? So we should be able to provide a lot of information about the patient, which will give you some good pointed indications, which will give you a lot of areas to look for. Yeah.
And see, sorry to cut you off. Like, I just wanted to, refocus on the areas what I see in India, which is basically I'm not sure like how many entrepreneur or doctors are looking around. Of course, everyone does have their own challenges, but Peter Kura, as I can say that we are committed to go at any mile to solve the patient, and that's where we always go confident about the last mile care. We don't want to just be centric around the tier one cities. That's where I'll give you a case study. I had one of the patient reported from Udupi, which is basically around 700 kilometers away, maybe 500 miles away from Karnataka. And that's where Vitakura took that opportunity, went to the patient, our patient was bedridden, and we took that samples, we ensured that the patient is not COVID positive. So, that always excites me that, if I have a support of technology, that the journey, what I'm looking to do in coming years, where I want to see health services reaching to the any corner of the country, that can only be possible when I have a solid technology background. And that's where I see Centric.
And that gives you also bridging the global divide.
Yep.
Why only in one country? Why not opening the globe? So I'm now thinking very loud, why not from the US to India? Many people here are deprived of that, state-of-the-art healthcare services because not everybody has the insurance. In the US, not every patient has been fully insured. And healthcare services is very expensive. So if you are enabling remote monitoring or remote healthcare services through some of the means which we can enable from here, and technology is available like what we are talking about, that means we can cover the world, complete global services enablement. So we can help you, whatever you are defining the services, and I'm pretty motivated and fascinated what you have defined. That is how we have partnered together with you. We will take you to the US market as well. As I see the opportunity, I can connect the dot. Wherever you can offer the services, technology will empower you. As you have mentioned about Udupi to Bangalore, why not San Francisco to Bangalore? San Jose to Bangalore. What it does, remote monitoring, remote care, remote services, what you need, the data. Data will be provided, the sample which will be processed, and the data is processed out of yours, right? That means whatever you are looking for, basic information, basic indications, what I say in the patient terms, and how do you provide the preventive measures or the care or prescription. That is what the patient is looking for. What is the lab looking for? If I'm giving the sample to the lab is giving the report. Who is able to analyze the report and provide me the best healthcare guidance? That is where Vitakura is now orchestrating all the last mile care. And that is where I see tremendous value across the globe. So I'm so motivated and fascinated because the opportunities are immense. Let's take a baby step, work together, and we will mobilize the resources for your good cause, what you have taken at Vitakura. At Centrique, I am committing all the technology resources to you with artificial intelligence, with intelligent process automation, with machine learning, all at your disposal so that you will grow rapidly on your mission to provide the last mile care to humanity.
Yes,
Thank you so
absolutely.
much for your time because I have really enjoyed talking to you. And let's work
Thank you so
together
much.
on achieving this mission.
You're welcome. Thank you so much for your time as well. You take care. Cheers.